Good morning, my lord.
Good morning, Mr. Turner. Now, you have a witness for me.
I do indeed. The first witness today, my lord, is Mr. Peter Kelly from the Poverty Alliance.
Very good. Good morning, Mr. Kelly.
Good morning, my lord.
Now, there'll be some questions for you from Mr. Turner, so when you're ready, Mr. Turner, please.
Thank you, my lord. Good morning, Mr. Kelly.
Good morning.
Before I begin, Mr. Kelly, just a confirmation that today's hearing will be transcribed. If you could try and speak slowly and clearly, that will help the stenographers significantly. Could you give your full name, please?
It's Peter Gerard Kelly.
And what is your current position?
I'm Chief Executive Officer of the Poverty Alliance.
And how long have you held that position?
I celebrated 20 years this year.
Thank you. And were you Chief Executive during the pandemic?
I was, yes.
Thank you. The Poverty Alliance, indeed yourself, Mr. Kelly, have provided a written statement to the inquiry. Is that correct?
That is, yeah.
And my lord, that is reference number SCI WT 0028 number 1. Just to confirm, Mr. Kelly, we do have a limited amount of time today to discuss some matters that arise in that statement. Even if we don't touch upon absolutely everything, the entire contents of the statement and indeed any other documents that you've provided to the inquiry will be taken into account. First of all, could I ask you to give His Lordship a bit of an overview of the Poverty Alliance? When was it established, and constitutionally, what is the Poverty Alliance?
So we were formally established in 1992, set up as a company limited by guarantee with charitable status. We act as the National Anti-Poverty Network in Scotland, so we bring together a whole range of civil society organisations, grassroots community organisations, large, well-known voluntary organisations, international NGOs, trade unions, faith groups. Really anyone, any organisation with an interest in helping to address poverty, and as well as that, people with direct experience of poverty can be part of the Poverty Alliance too.
Thank you. And where is the Poverty Alliance based?
We're based in Glasgow.
And where does it operate?
Across Scotland, but given the nature of poverty, a lot of our work also tends to influence in policy at the UK level too.
Thank you. You mentioned that you bring together a number of organisations, and you gave lots of examples there of the types of organisations that you bring together. How are those organisations arranged? Are they members of the alliance?
They are. So we have full members. Essentially, the difference between full and associate members is that full members have voting rights at annual general meetings and can determine policy and sit on the board of trustees of the Poverty Alliance. Associate members are, I guess, akin to supporters, really. We also have a wider network of organisations that we're in regular contact with, but who aren't members of the Poverty Alliance. But our primary focus, I guess, is on those who are formally members of the Poverty Alliance.
Thank you. And how many members does the Alliance have at the moment, Poverty Alliance have?
At the moment, we're just over 500 members. About 4/5 of those would be organisational members, both full members and associate. Only organisations can be full members as well, I should say that. So we're primarily a network of organisations rather than a network of individuals.
Thank you. Just to be clear, that you said they're only organisations, and you mentioned individuals, so individuals can be members but not full members, is that what you said?
That's correct, they can only be associate members.
Thank you. You mentioned that you've got around 500 members. Was that the same at the start of the pandemic?
At the start of the pandemic, we had around about 340 members. One of the consequences, one of the decisions that we took at the start of the pandemic was to make a greater effort to reach out and to recruit more members, and we did that by reducing our membership fees, making it free for the vast majority of what would be community and voluntary organisations in Scotland. And so therefore we saw that and have seen that increase in membership over the last 2.5 years or so.
Thank you. You mentioned there that it's free for some of your members. I take it from that it's not free for others of your members.
It's not free for all, no. It goes on a sliding scale depending on income. So any organisation with an annual income of less than $500,000, it's free, which, as I say, is the vast majority of civil society organisations in Scotland. And then there's a maximum fee for organisations with an income of over £1 million a year.
Thank you. And is that how the Poverty Alliance is funded, or from those subscriptions, or are there other sources of funding?
No, those subscriptions make up a relatively small part of our income. Our income is from charitable trusts. We're funded by Scottish Government to deliver a number of programmes there, some of which I'll probably touch on during the evidence. We also earn income through training, through our accreditation programme, so we have a range of sources of income.
Thank you. So the majority of your funding's grant funding just on an ordinary basis, that even aside the pandemic for a moment, grant funding was just your normal way of being funded?
Yes, the majority of funding is grant funding, yeah.
And did that change at all during the pandemic? Did you have any pandemic specific funding?
We had very small amounts of funding from Scottish Government that allowed us to purchase some hardware for members, people who have direct experience of poverty, who were working closely with us. We managed to access some funds for that, but it wasn't something that we sought to. We didn't require additional funding for the work that we were doing.
Is there a reason? We've heard evidence this week, or indeed the last couple of weeks, regarding lots of different kinds of organisations needing funding during the pandemic. Was there a reason why the Poverty Alliance didn't need any funding during that period?
For the work that we were doing, our purpose, our way of working didn't really change. What we were trying to achieve didn't really change in terms of influencing policy and practice around poverty. The means through which we did that obviously changed, as it did for everyone. So we didn't require additional capacity. We changed the way that our programmes were operating, but we didn't, at least in our assessment, require additional funds to continue to do what we were doing.
Thank you. We've heard, His Lordship has heard evidence this week regarding, for want of a better word, the squeeze on third sector organisations in terms of funding. Do you feel that the Poverty Alliance's funding position is secure as matters stand?
It is. We've been squeezed in some respects. Some sources of funding, particularly Scottish Government sources, have changed over the last couple of years. Not during the pandemic, I would stress. So our funding at that point remained unchanged. But since then, like many organisations in the third sector, we've seen some reductions in funding from Scottish Government. But as I said, we have other sources of income, and we have a source of earned income which is reasonably secure, which is very healthy given the context that we're in. And we've also been successful in grant funding from other charitable trusts.
Thank you. I'd like to ask you some questions now regarding the operations of the Poverty Alliance. First of all, we obviously know that the Poverty Alliance has a chief executive. Could you tell us about any other staff or volunteers that the Poverty Alliance has?
So, do you want me to talk about the time of the pandemic or now?
Well, I suggest both would be interesting if there is a contrast.
So at the start of the pandemic, I think we had around 16, 17, maybe 18 staff. The majority of them full-time. We now have 29 staff, I think, 30. And that growth is as a result of new projects coming on over the last 3 or 4 years. The staff team works across a range of particular projects and teams. So we have a policy and campaigns team. We have what we call communities and networks team. They are responsible for engaging with our members, primarily responsible for engaging with our members and engaging with people with direct experience of poverty. We have a team that works only on the living wage, on promotion of the living wage to employers across Scotland, and we have a research team, and additionally we have an admin team to keep the whole thing together.
Thank you. We know in the third sector, again from evidence we've heard, that a lot of third sector organisations rely on volunteers. Is that something that the Poverty Alliance relies upon?
We have volunteers who work through a range of projects, so depending on the particular makeup of projects at any one time will depend on the number of volunteers that we have. Largely those volunteers are all people who have some direct experience of poverty, so we have part of our work is something called Get Heard Scotland, again, which we'll probably refer to throughout the evidence, where we work with people with direct experience of poverty. We have something called our Community Activist Advisory Group, which is made up of people with direct experience of poverty, and the numbers involved in that can vary. At the time of the pandemic, I would say there were probably about 30 people involved in the Community Activist Group. We also now have something called the Participation Bank, which allows people to sign up with us and drop in and out of areas that we're working on that they're interested in and have something to contribute. There's around about 100 people who are involved in that who will contribute to various projects at different times.
Thank you. And you've obviously told us about the numbers of staff increasing since the beginning of the pandemic. Were all your staff engaged throughout the pandemic, or did you take advantage of any of the furlough schemes?
We didn't take advantage of the furlough schemes. We moved to fully home working, and despite the usual sort of teething problems with that shift to home working, the majority of work we were still able to do. I mean, influencing government, lobbying government, didn't require us to be at the Parliament or to be at St Andrew's House. We could do that remotely, so we continued to do all that work. Some of the work we did engaging with organisations and particularly engaging with people with experience of poverty proved more challenging, but we did get there. So we didn't have a need or a desire to furlough anyone. We recognised the importance of the work that we were doing, that work had to continue, so that's what we did.
Thank you. And in terms of the substantive operations of the Poverty Alliance, does it have any specific strategic aims?
Yes, so we have 5 outcomes. You're going to test me on my own strategic aims. So we have the first 3 of those outcomes are what I refer to anyway as the sort of external ones. The first one relates to securing adequate incomes through social security. The second outcome is around improving jobs that help to tackle in-work poverty. The third is around improving services that prevent or reduce poverty. So those 3 outcomes primarily focus our activities around our practice and policy influencing work. All of our work should be around those 3 outcomes. The 4th and 5th outcomes, the 4th is around building a network, which is fairly obvious, building a strong network capable of tackling poverty. And the 5th is around a more internal facing outcome, which is about building the capacity of the organisation to deliver on those 4 other outcomes.
Thank you. I'd like now just to talk to you briefly about poverty, clues in your name in terms of the work that you do. Could you assist His Lordship by explaining what exactly poverty is, how that's measured or how that's described in your work?
Okay, so poverty in Scotland is clearly a long-standing issue. This isn't something that's related to the pandemic. Obviously, the Poverty Alliance has been around for 30 years. There's been organisations trying to tackle poverty for a long time. Currently, there are about just over 1 million people living on low incomes in Scotland. there's a standard, well accepted measure of poverty, which is 60% of median household income. We use we use that to measure, as does Scottish Government, as does UK Government, to track changes in the patterns of poverty, to identify key groups at risk. And so that just over 1 million is around about 1 in 5 individuals in Scotland living on a relatively low income. Some groups are at greater risk or have higher proportions. So child poverty currently stands at around about 24% in Scotland. About 15% of pensioners in Scotland are currently classed as living in a low income. And then we need to further break down those statistics to give us a better understanding of who's at risk. For example, children from black and ethnic minority families are at significantly greater risk of being in poverty, so more than half. Lone parents have a significantly greater risk of poverty. Where someone has a disability, either an adult or a child, then any children in that household are at greater risk of being in poverty, so around about 40% of children who are in a household where there's a disability are in poverty. So you can start to see, we use that income measure of poverty, but we can start to get underneath that and see particular groups that are at risk of poverty. And I guess some things, talking about it in terms of those statistics and those patterns can seem perhaps a little bit antiseptic. Those patterns are very consequential. They obviously have an impact on individuals, on families, and on community well-being, and that's the reason why we seek to tackle poverty. It has an impact on outcomes in relation to education or to health, mortality, to mental health, again, some of the issues that we'll undoubtedly touch on today. And I think the final point I would say about the changing nature of poverty, we've seen a steady increase over a long period of time, but to an extent where it's an increasingly dominant part of our understanding of poverty is the increase in deep poverty. So the proportion of people who are falling further below that 60% household medium threshold, we take a 40% threshold, and we see that it's dipped slightly in the last year, but around about 40% of people who are in low incomes are in what we refer to as deep poverty. And we also see that reflected in increasing numbers, not only in Scotland but across the UK, who would be classed as destitute as well.
Thank you. You mentioned there, Mr. Kelly, a number of different demographic groups, age, minority ethnic groups, single parents, disabled, no doubt various others. I also noted that you referred to some of those groups, I suppose using more than one demographic in respect of them. You'd said ethnic minority children, for example. Is there any sort of correlation or interaction between these demographic groups in terms of poverty?
Absolutely. So, I mean, a useful way to illustrate this is the Scottish Government has a child poverty strategy. In that strategy, they identify 6 priority family groups. Again, the groups would be lone parents, large families, families where the youngest child is aged less than 1, black and ethnic minority families, families where there's a disability. And it's important not to, those families make up probably around about, I think, 90% of the children who are in poverty. But obviously there's a lot of crossover between those families. Black and ethnic minority, lone parents where there might be a child with a disability. So it's important to use the jargon to take an intersectional approach to understanding the nature of poverty, that it's is not simply an income threshold and we can apply that, but we need to get underneath that to understand how those different patterns connect with each other and the different consequences that has for individuals and families.
Thank you. I'd like to ask you now about the role of the Poverty Alliance during the pandemic. Were there any shifts in that role in consequence of the pandemic?
I mean, I think the biggest shift for us as an organisation was making that transition to remote working. As I've kind of alluded to, much of the work that we do in terms of engagement with grassroots organisations, and particularly with people with direct experience of poverty, was face-to-face and has largely returned to being face-to-face. So there was a shift in that respect, but in terms of our purpose as an organisation, to bring organisations together, to bring individuals together, to influence policy and practice, if anything, that was given a sharper focus by the pandemic. We very quickly moved to identifying what were some of the key asks that were different from what they might have been 2 or 3 months prior to the pandemic. And we worked in ways to make sure that those key asks and that the voices of our members and people with experience of poverty were able to be heard by policymakers. So there was a shift in the method of delivery, but the actual focus was, I would say, really pretty much the same.
You've mentioned that the numbers of staff increased during the pandemic. Does that mean that you were adding to the service lines that you were having, or was there anything that you had to put on a back burner during the pandemic?
I think there was new research project. I'm trying to remember exactly what the changes and patterns of staffing were. There were new research projects that we added to the work. There was some changes, some staff left the organisation. Some of those things went on as normal. You know, people leave organisations, new people join. So we had all of that. But in terms of the core numbers, we probably didn't see that change in numbers really probably until we were coming out of the pandemic. We've had a couple of fairly significant new projects added to the work. We've expanded our administration team, so some of that came after the pandemic, so it wasn't, that increase in numbers wasn't necessarily a consequence of new work being taken on during the pandemic.
Thank you. Did you have any direct engagement with government or public authorities during the pandemic? Let me ask a different question. Yeah. Do you have any engagement with public authorities ordinarily, and did that change during the pandemic?
We do. Ordinarily, our purpose is to influence policy. The way that we do that is we do it in a variety of means and methods, sort of external campaigning, and being in the room with policymakers, and that remained the same again during the pandemic. I think at times it was more difficult to get some responses from government, but at others we were having regular engagement with Cabinet Secretary level. Certainly at the start of the pandemic, we were engaging fairly regularly, I would say, with the Cabinet Secretaries for Communities and Local Government, Aileen Campbell. So in that respect, we continued to engage. We engaged with politicians across the political spectrum as well. That's again part of what we do, not just simply engaging with government, and both, probably less so at Westminster, more so in Scotland. So those kind of engagements continued, and also I should say with local authorities as well. We have pretty good contacts with Scottish government, with Scottish local government, across the country, and we were fielding requests for information and advice from some of those parties, particularly in the early phase of the pandemic, when everyone was trying to understand how best to respond.
Just to be clear, Mr. Kelly, you were fielding questions from public authorities?
At times, yes. So we had one initiative, one project called Get Heard Scotland that I've mentioned. Its main purpose was to engage people with direct experience of poverty related to the Scottish Government's child poverty plan. And at the start of the pandemic, we would have been working in Inverclyde and Renfrewshire. So we had regular engagement with officials in those two local authorities, but we had worked in 2019 in North Ayrshire, in Highland, in East Lothian, sorry, not in East Lothian, in West Lothian. We had project work ongoing in Edinburgh and Glasgow. So by the nature of those projects and those contacts, we were coming into contact with officials who were familiar with our work, and particularly, again, we may touch on this around distribution of emergency food, talking to some local authorities about what we thought good practice would look like.
Thank you. You obviously had existing relationships with a lot of these organisations in government. How did you find accessibility during the pandemic compared to at other times?
That's a really good question. I mean, I spent a lot of time reviewing emails, and there was a lot of traffic. There was a lot of back and forth with some local authorities. I mentioned North Ayrshire. I remember specifically them coming to us and discussing, well, how do we best deliver emergency food, or what alternatives if we were critiquing what was going on. But undoubtedly, officials who we had regular contact with, who were working with us on, particularly on the Get Heard Scotland project, which was planned to go on throughout that year. Those officials were taken off of some of the regular tasks that they were doing, like working on projects with us, to attend to more immediate, more pressing issues. So where we could fit with what those more immediate and pressing issues were, then the contact remained, I think. And with Scottish Government, with the Cabinet Secretaries that we were primarily engaging with, the issues that we're trying to connect with them on were things that were central to their portfolios, were central to their concerns. So there was still a desire on their part and on ours to have that engagement. I think there was a recognition that there was valuable information from organisations like the Poverty Alliance and other third sector organisations and civil society organisations that government required at that time to help them shape the response. And again, we might want to touch on that later.
You've mentioned, of course, that much of your work pre-existed the pandemic and continued through the pandemic. If public authorities were focusing elsewhere, did you feel there was any detriment to any of the projects that you were working on?
The projects we were working on changed. So the focus of the projects we were working on. So, for instance, again, I keep referring to this Get Heard Scotland project, but that was an important one for us at that time. It focused entirely on aspects of the experience of the pandemic. So previously, I'll try to be brief on this, but previously it was quite an open programme. We went to community organisations who we would work with to engage with people with direct experience of poverty to understand what were the issues that were important to them. We slightly changed the focus of that to say we understand in the context of the pandemic there are certain emergent issues that are critical, and we're going to ask about those issues because those are the ones that we think, through our analysis and through our engagement with other organisations, are of importance. So the issues that we focused on were jobs, and what was happening with jobs, what was happening in the labour market, mental health and digital exclusion. So those were some of the big issues that we used that project to focus on. So rather than a fairly open process, it became one that was a bit more constrained and tightly focused, which I think was necessary and to the benefit. So I don't think there was a detriment necessarily to the work that we were doing. Particularly, I guess I'm focusing on the 2020 phase of the pandemic and the 2020 phase of the inquiry, and that changed throughout the pandemic as issues changed, as the concerns changed over the course of the period.
As the pandemic went on, as you say, once we leave 2020 and we come towards the end of the pandemic, did you find that focus changing then?
Yeah, and I guess there's something in trying to draw out, and as I've been reviewing some of the work that we did over 2022 in particular, of drawing out where the issues that we as an organisation were addressing that were specifically pandemic related, and those that were part of what was then started to be called the cost of living crisis. There was an overlap, and to some extent it wasn't necessary for us really to say, well, this is a pandemic issue or this is a cost of living issue. I guess one area that would be indicative of that would be around energy and fuel poverty, and that was a question at the start of the pandemic as people were in lockdown and at home and using energy in different ways than they would have been, to the period going into 2022 and throughout 2022, where obviously the cost increases were the key issue rather than perhaps just the use issue. So it was still an issue. It was still a question that we had to address, and one that we were, particularly in 2022, lobbying on far more significantly. But the nature of it changed over those 2 years.
Thank you. You mentioned there obviously the cost of living crisis and other factors that might influence poverty. Is it possible in your work to divorce the effects of the pandemic from any other influence, or is it seen as a whole?
I suppose there's a phrase, and I know colleagues from Glasgow Disability Alliance will be joining you at some point. They referred to this notion of the pandemic supercharging the experiences of disabled people, and I think there's an extent to which you could apply that to many groups experiencing poverty, that challenges for those groups existed prior to the pandemic. Challenges around living on a low income existed prior to the pandemic. What the pandemic did was intensify many of those experiences, make them worse in most cases. And what our role, and what I think what government was trying to do, was reduce the impact of some of those negative consequences for people who were on low incomes. I think there was a popular phrase at the start of the pandemic that that we were all in it together, a phrase that's been used at other times in recent history as well. And it was quite clear to us, and I think quite clear to Scottish Government, that wasn't actually the case. We were all affected by the pandemic, but it was quite clear that not everyone was affected in the same way.
Could we please have document SCI HNS XXX5? This is a report from the Social Renewal Advisory Board. If not now, when? From January 2021. Are you familiar with that report?
I am, yes.
And could we please turn to page 2? Just there. It struck me just from what you said there, Mr. Kelly. There's a line here which says, we may all be in the same storm, but we are all in different boats. And even then, too many of us are with no boat at all. Indeed. Would you say that's a fair summary of what you've just said?
It absolutely is, yeah. It's a very apt description, I think, of the experience that many people that we were working with had. That there are various tropes around the pandemic of people locking down, going for walks in their neighbourhood, of adding to their bank account as they spent less during those initial phases. That very much wasn't the experience of the people that we were working with, where if anything they were running down any meagre savings they may have had, getting into debt, living in accommodation that was all too often overcrowded, with insufficient green space to take advantage of opportunities to get outside. So very much not everyone was in the same boat at all.
Thank you. We're now looking at it, so I'm going to just talk to you about this paper, or indeed particularly the Social Renewal Advisory Board. I understand that the Poverty Alliance was not part of the board, but you did contribute to the work, is that correct?
We did. We contributed to the Low Income Circle, so that was the one that was led by I think the Poverty and Inequality Commission organised that one. We fed into that. We organised some people with direct experience of poverty to have a discussion around the themes that circle was exploring. And more broadly, we supported an initiative in Edinburgh called End Poverty Edinburgh, which I think I can actually see on the page here. They refer to 4 Poverty Truth Commission groups. That End Poverty Edinburgh group was effectively one of those commissions, but it was one that we supported at that time. So they would have been involved in contributing to some of the thinking around the Social Renewal Advisory Board as well. And I guess that looking at the makeup of the advisory board, we some of those organisations represented were members of the Poverty Alliance, some of them quite close members, so there was a regular engagement around some of the discussions that were going on. And I certainly recall towards the end of the process of the advisory board engaging with civil servants around some of the key issues that were starting to emerge where we had expertise.
Thank you. Did you feed into this report then through your work with the advisory board?
We weren't, obviously, as you pointed out, we weren't on the advisory board, but we were feeding into it, some of it informally, some of it more formally through those circles, through the circles.
Thank you. The report, and I quote, makes reference to a call to action, a call not to hold back social action which made the difference to so many lives, but instead to unleash it so it can grow. I think that's something that very often is referred to something like Build Back Better. Yep. Are you familiar with that phrase?
We organised a series of webinars very early on in the pandemic around the topic of building back better. So yeah.
Do you feel that those calls are being followed up upon?
I need another afternoon to discuss that. There are undoubted. There are 20 calls, I think, were in the advisory board's report. There are obviously other advisory groups were set up at that time as well. There are undoubtedly some that are being followed up and being, I think, seriously followed up. So the one that I'm most familiar with and that we're engaged with is around the minimum income guarantee. There was, I think it may well have been the first recommendation in the report, was to at the very least investigate the potential to establish a minimum income guarantee that would address some of the failings of our particular social security system, but interlocking with services and work, our labour market. And that undoubtedly has been followed up. There isn't something that's been delivered that you could say, well, there's the minimum income guarantee or there's the start of it. But the Scottish Government, following the election in 2021, set up an expert group to look at the idea of a minimum income group, or declare an interest. We are part of that expert group. It's been meeting regularly since then. We'll report at the end of this year, beginning of next year, with a series of proposals that will hopefully start to see that minimum income guarantee progressively introduced over the coming years. So there are undoubtedly some that have been followed up, some around the circle that we were involved in. There were calls around fair work conditionality on employers to encourage employers to adopt more fair work practices. I think there's certainly been efforts to try and make that happen. Not all of them have been successful, but there's certainly been efforts. There was a call in there around introducing a programme of living hours, which is similar to the real living wage and accreditation scheme that encourages employers to provide minimum number of hours and so on. We're doing that work. We're supported by Scottish Government to deliver some of that work throughout Scotland. We have employers who are signing up to guarantee minimum numbers of hours and conditions and contracts and so on. So, you know, there's a lot of recommendations there. There's a lot of detail in that report. Some of it is being carried forward. Again, the context has changed since 2021 when this report was produced. The cost of living crisis, not least changes in government and so on. But I think there is a desire to, certainly amongst civil society organisations that are involved, to ensure that there is a memory of that call to action and that it's taken forward.
Thank you. In terms of engagement, just one last area I wanted to touch upon. You mentioned in your statement that the Poverty Alliance were members of the Child Poverty National Partners Group. Yep. Can you tell us about that?
So that's a grouping specifically around the child poverty. It comes out of the Child Poverty Act, which has set the targets to reduce child poverty in Scotland by 2030. There's an aspect of that act that requires local authorities and health boards to produce regular reports on what they're doing to address child poverty, and we're part of that a group alongside Child Poverty Action Group, the Poverty and Inequality Research Unit at Glasgow Caledonian University, the Improvement Service, representatives from Scottish Government and Health Scotland, that tries to give advice and give support to local authorities and health boards in developing those annual plans and those annual action plans to help them tackle child poverty. So it's very much a support group is probably the wrong phrase, but it's there to provide help, assistance, guidance to statutory partners in their work around child poverty.
Did the group exist pre-pandemic?
It did, yes.
And its work presumably continued through the pandemic?
Does, yeah.
Did the focus of the work of the group change at all during the pandemic?
It did. I'll be honest, I will struggle to recall those meetings at that time. I know that they did continue, and certainly the colleagues at the Poverty and Inequality Research Unit at Spyro at Glasgow Caledonian, I produced some really useful reports on what local authorities were doing differently at that point, and if in the pandemic, you know, how they were changing the way that they engaged with third sector, how they were trying to deliver services in a new, perhaps more agile way than previously, and that's kind of a flavour of the approach that the National Partners Group was trying to take at that time. Was, well, what is the need now? You know, the need was not so much on, are you producing your child poverty action plan in June 2020? That clearly wasn't the focus. The focus was, what is it you're doing to actually help those families and those individuals who are at risk of poverty. So we were very much trying to share information about what different local authorities or what different action was happening at local level. So that was, I guess, the change in the focus from the National Partners Group at that time.
Thank you. I'd like to move on now, Mr. Kelly. I'm going to ask you some questions about the experiences of those living in poverty, if I may. First of all, we all lived through the pandemic, so I'm sure I don't need to tell you what happened in terms of lockdowns and restrictions on people's lives. I wondered if there were any particular impacts arising out of that might have affected people living in poverty differently.
I think, I mean, again, it's useful to refer to that, you know, all in it together, or same boat, different storm, or different boats, same storm. You know, if we take, for example, the issue of food and food insecurity and access to food, I'm sure everyone involved remembers the panic buying, the hoarding, the baking bread and all that kind of business. I think for people who were living on low incomes, that issue around food insecurity was particularly acute, especially in those early months. But really, you know, we have had a growing problem of food insecurity in the UK and in Scotland for more than a decade, a consequence of, I would say, changes to our social security system. That issue of rising destitution that I mentioned, that's absolutely directly linked to changes in our social security system over the last decade and a bit, and that manifested itself in challenges around food insecurity. So what we saw was, so the experience of people on low incomes that's reported to us is a very delicate balance. You know, is you know, there are a few people who are better able to budget than people who are on low incomes, and those budgets were really challenged at the start of the pandemic, when people couldn't access perhaps some of the cheapest foods in supermarkets because they weren't there, where their ability to access those foods as easily, to shop around, as many people on low incomes will know exactly where to go and when to go to find the best deals. That all became far more difficult to do, and so we saw quite a significant response from both local authorities, public agencies, and the third sector to ensure that people were able to access food when they needed it. So if you weren't able to get out to shops, if you were shielding, if your income had dropped and therefore you were needing additional support, so your income had dropped because either you'd lost your job or you'd been furloughed and your income dropped by 20%, or because you were making a claim for universal credit and there's a waiting period for that of at least 5 weeks, then people were needing to access emergency food aid. So we saw a significant increase in the need for emergency food aid throughout that, particularly that initial period, but really throughout the pandemic.
Thank you. We know, for example, that some of the restrictions affected people's ability to get out of their houses, people's ability to travel, and the like. You've spoken about the intersectionality affecting lone parents and children and the like. Were any of these factors exacerbatory in terms of the experiences caused by lockdown or other restrictions?
Yeah, so I think some of the things that were reported to us, and we've shared a couple of the reports that came from our work in Inverclyde and Renfrewshire. The effects of lockdown were challenging for everyone. They pose challenges for our mental well-being generally, I think. But I think people on low incomes felt those stresses that came with lockdown, felt that isolation in particular ways that were different than perhaps other people who weren't in that situation. I think there is almost no question that throughout the pandemic, throughout the 2 years that the inquiry is reviewing, the issue of mental ill health is one that has just recurringly been raised with the Poverty Alliance through a whole range of forums and processes. We now have work ongoing to find ways to better support our members in delivering support around mental health to people that they're working with who aren't specialists, organisations that aren't specialists in issues around mental health. And I think that sense of fear coupled with that again, many of us, all of us experienced about the potential risk to health as a result of COVID-19, that coupled with what's happening with my income, I'm having to look after my children full time now because they're not at school, and my childcare has disappeared, but I'm being asked to pay for it. You know, those kind of pressures really intensified for many people on low incomes, or the withdrawal of services, the withdrawal of social care packages for many people. That intensified experiences for people who were already stretched, who were already struggling to make ends meet. When you know, for some their budgets may well have stayed the same if they were in the same situation, if they weren't in paid employment. But for others, you know, that loss of even low paid employment was really consequential, and that had impacts on their mental health and well-being, and it would have had impacts on their finances over the longer term as well.
Were there any social factors that fed into that as well? I note in particular in your statement you referred to there was a lot of reporting of a greater sense of isolation and concerns about the mental health aspects of that isolation.
I mean, those two issues are, in my mind anyway, almost impossible to separate. That sense of isolation with the consequence of that being, you know, challenges around mental health. And some of those challenges were also about where to get help and how to get help, that many people wouldn't have been able to go to organisations that might have been trusted organisations in their community because they weren't open. They were, you know, to the large part closed. I guess one thing to highlight in that, though, in that sense of isolation and that consequential impact on mental health, is the role of, I think, particularly third sector organisations in delivering some of that emergency support that I mentioned, particularly around food, but, you know, deliveries were also of a variety of other things, where it was medication and prescriptions and so on, or activity packs for children. I know organisations were delivering those kind of things at that time. That contact and that sense that there were people who were concerned for your well-being, that you had been identified as someone that might need a bit of support. By and large, I think that was incredibly important for people who were experiencing that. There's organisations in our network that I know were reaching out to people who maybe they hadn't engaged with previously. So there was that sense that whilst many people were isolated, and again, particularly in those most severe periods of lockdown in the spring and then in the winter, that those efforts by third sector organisations, I think, are really commendable, that they were able to create those connections and maintain that sense of community where in some cases there hadn't been previously. So they were able to undermine that sense of isolation. But there undoubtedly people were feeling afraid, and when they're feeling afraid and they couldn't have all the usual social interactions, that had an impact on their mental health.
Do you feel, you've obviously told us about the intersectionality between a lot of the groups that are affected by poverty, and knowing about those demographics, do you feel they were particularly vulnerable to some of these risks of isolation and mental health issues?
I think I've mentioned lone parents a couple of times. I've mentioned disabled people. I can recall meetings that we had during the pandemic, again in 2020, where that sense of isolation was palpable for people who were who perhaps had a disability, who were living on their own, or for lone parents who were looking after children on their own, and those restrictions. It's from the perspective of 2024, it's almost hard to remember just how tight those restrictions were, and how people were complying with those restrictions. So not to see family members, for lone parents, that for any family that's a difficult thing to do, but for lone parents to look after their kids on their own, and not rely on family support in quite the same way, or at least to feel as though you were breaking rules if you were trying to rely on that family support. I think that was a significant impact for those particular groups. And again, we see some groups, black and ethnic minority families, people in black and ethnic minority communities, where there was a greater propensity to live in overcrowded accommodation, more likely to be in BME communities, more likely to be working in situations where it wasn't possible to work at home. So that risk of being exposed to the virus as well, I think that again had a consequential impact, and that is related to their experience of living on a low income, of working in a predominantly low paid occupation in hospitality or retail.
Thinking of some of the restrictions, for example, you mentioned there in terms of the ability to contact other households and the like, do you feel that the disproportionate impacts that affected people living in poverty because of their circumstances, because of this intersectionality, do you feel that was taken into account enough in terms of some of the decisions that were made?
I think the rules that were in place were intended to apply to everyone regardless of their circumstances. And I think the additional pressures that families living on and individuals living on low incomes were experiencing weren't given due regard, I think, in the development of those restrictions. And it may well be that given the evidence that we had at the time about the nature of the virus and how it's transmitted and so on, that those restrictions were simply what they had to be. I don't have the expertise to say otherwise, but I think there wasn't necessarily an understanding of how that would impact on people on low incomes in a different way. So again, another issue that we haven't actually touched on so far is that one of digital exclusion. So the fact that young people were having to be taught homeschooled and relying very much on digital resources to be able to do that. There was, I think, an effort to, through the Connecting Scotland programme, to try and ensure that people had access to devices. But we know that despite those, I think, really quite good efforts on many parts and the efforts of third sector organisations and local authorities to make sure that everyone had devices, that wasn't always our experience of how that worked in practice. Was that there were still challenges. You had a device that for some people, perhaps not young people, but for some people were unable, they didn't have the digital skills to be able to use them, or didn't have the resources to run those pieces of kit when they had it. So I think it's difficult to envisage how those restrictions, as they were developed, could have been flexible for people who were on low incomes. But I think there were built-in flexibilities for some. But I don't know that what was driving those flexibilities was we need to accommodate the experiences of people who are living on low incomes. It was more, how do we maintain food deliveries? It just so happened that those people who were doing food deliveries or who were keeping supermarkets open were also people who were more likely to be working in low-paid occupations.
Thank you. It's probably implicit from the fact that we're talking about poverty that we're talking about people's finances. Again, it's implicit that if you're living in poverty that your finances are in a more difficult position. But I wonder if you could give His Lordship an indication, just very broadly, how you feel people living in poverty's finances fared over the pandemic.
Indeed. So I think we know that, I think I touched on it earlier, savings were reduced. We saw for those who were in work and in 0 hours contracts, working in those kind of situations, they saw their hours disappear. They saw their income disappear, and not always necessarily replaced by some of the schemes that were available. For people who were furloughed, then their income generally dropped by 20% unless their employer chose to top it up. So we saw more people who were on low incomes worried about their finances in that period at the start of the pandemic, but also throughout. Work by Aberdeen Financial Fairness Trust, they surveyed people throughout the pandemic, and they saw an increase in anxiety around financial precarity amongst people who were already on low incomes throughout the pandemic. And we saw that reflected in an increase in debt amongst people on low incomes, again as a consequence of some of the ways that our social security system works, where people were almost required to go into debt, either by getting advance payments through the universal credit system, or using other forms of debt, using credit cards and so on. We saw all of that. So the impact on personal finances, if you like, were were undoubtedly negative for people who were already on low incomes. As I say, for some, the experience of the pandemic was an inability to spend. For those who were on low incomes, the experience was having to spend more to keep their heads above water.
Was there any additional funding available to support people during the pandemic?
There was I suppose a range of funds that were made available in Scotland. So thinking only about the Scottish funds, obviously there was an uplift to universal credit that was introduced. That's a UK reserved policy. I think probably the most important ones in Scotland would have been the Scottish Welfare Fund. So Scottish Welfare Fund is a system of grants that are available through local authorities funded by Scottish Government to provide emergency support, and that was a system that was in place prior to the pandemic. And one thing that I think is notable is that we in Scotland still had that system of crisis payments and emergency payments, whereas in other parts of the UK it had been devolved entirely to local authority level. We had maintained a Scotland-wide system, albeit with local variation. And I think that was quite important in our response to the pandemic, that system was there and could be used as a means to try and get resources to people. I think there are questions about the effectiveness of it, but I think the structure of it was there, and the Scottish Government certainly made additional resources. I think something in the region of 55 million, I think it was, for the Scottish Welfare Fund in that first year of the pandemic.
You mentioned there the effectiveness. I mean, what issues were there? Were there accessibility issues, or what issues were arising?
So there has been with the Scottish Welfare Fund, there has always been issues of the promotion of the fund by local authorities, and therefore of awareness amongst those who might require its support. So that predated the pandemic. I think the Poverty and Inequality Commission did some work, I think quite early on in the pandemic, looking at the use of the Scottish Welfare Fund, and I think they found that against expectations, despite the fact that additional funding was available, that wasn't being delivered at the rate that they would have expected, given at that point we were in the absolute teeth of the pandemic. And I mentioned the massive increase in I think it's in my evidence. One food bank we worked with, I think a 300% increase in use of their food bank, and other organisations reported similar astronomical increases in the delivery of emergency food aid. So in that context, you would have expected a source of cash support that was available to be, if anything, oversubscribed. And what the Poverty and Inequality Commission were finding at that time was that it was being underutilised. And some of the things that they pointed to, and that certainly we have seen ourselves in our own work, is that lack of promotion of the scheme. There was also a question over whether staff who were previously working on the administration of Scottish Welfare Fund and local authorities were perhaps moved on to other tasks. We know that in the public sector people were moved around really quite fluidly, which in most cases was a good thing, but in some cases, perhaps like in the case of the Scottish Welfare Fund, it meant that people weren't getting access to that support. I think spending did increase throughout the year, but certainly we would have expected that to have been of greater consequence at that early stage of the pandemic.
Thank you. I'm sure we could talk all day, Mr. Kelly. We've just got a few minutes left, and I'd like to turn now to the question of lessons. His Lordship is tasked in terms of the inquiry's terms of reference at looking at lessons that might be learned in terms of the strategic response. I wondered if you might have any particular lessons that you wanted to highlight, or things that you think His Lordship may wish to consider.
Yes, there's probably a number of areas that we could touch on. I think, let me try and summarise a few. So the problems that that people living on low incomes experienced during the pandemic were not simply a problem of the poverty they were experiencing. It's a wider problem of inequality in our society, and I think that needs to be given greater prominence in our understanding of how do we respond to challenges like this as a society in the context of a quite divided society. What does that mean for how we respond to these kinds of issues? I think the other challenge going into this pandemic was it came on the back, and I know this point will be made by others, and I'm sure repeated in the weeks and months to come. We went into this pandemic on the back of a period where there had been underinvestment in public services. So those public services that people were relying on had, to greater or lesser extents, seen cuts and reductions in their support. So that meant they were, I think, less capable, less prepared for responding in this way. That being said, I think in terms of some positive lessons from the pandemic, what we witnessed across the country were really good examples of where particularly local authorities, but also Scottish Government, were working with third sector organisations in quite strategic, genuinely collaborative and partnership ways that had a real impact on people and had an impact on reducing the impact of the pandemic on people who were living on low incomes. And I think maybe just two final points, if I have time. There was something about the certainty of decisions that were made, and again, I think everyone understands that we were largely in uncharted territory in terms of the virus and how it was changing and developing, and our understanding of it, and that therefore decisions had to be made quickly. But some of the uncertainty over some of those decisions, so for instance, and again this isn't a Scottish Government question, but I think probably we could apply it to some of the decisions the Scottish Government made, but the decision around furlough constantly changed throughout the pandemic. That had consequences not just for businesses and their ability to plan throughout the pandemic, but for people who were in work and not knowing, am I have to go back into work? Am I going to be at risk from the virus? Is my income secure? Is it not? That uncertainty, any approach to responding to this kind of crisis in the future that reduces that uncertainty, particularly for people who are living sometimes quite precariously, would be welcome. And I think we saw, the final point I would make is we saw the importance of our social security system in the pandemic. We saw the weaknesses of it. That's why we had an uplift to universal credit. But we saw the real vital importance of our social security system in providing a lifeline to people when they needed it. Governments, I think Scottish Government does well in its articulation of what the social security system in Scotland is for and its purpose. I think we would do well, governments would do well in reflecting on what the purpose of social security is and the important role it played during the pandemic in maintaining some people's incomes in the most difficult periods, and thinking about if they're to take forward that idea of building back better, then changing the way that our social security system works, really implementing a minimum income guarantee over the over the coming years would be a priority.
Thank you. My Lord, that's all the questions that I have, unless your Lordship has anything to add.
No, thank you. Thank you, Mr. Kelly. That's all. We'll come back at 11:30.
Thank you.
Mr. Turner, you have another witness for me, yeah.
I do indeed, my lord. The next witness is Miss Kirsty McKechnie from Child Poverty Action Group in Scotland.
Good morning, Miss McKechnie.
Good morning, my lord.
Mr. Turner will have some questions for you. When you're ready, Mr. Turner.
Thank you, my lord. Miss McKechnie, just a quick reminder, first of all, that the hearing will be transcribed today. Do try to speak slowly and clearly. That will help the stenographers a great deal. I will try to do the same. Could you, first of all, please state your full name?
My name is Kirsty McKechnie.
Thank you. And what is your current position?
I am the project manager of the early warning system in Scotland for Child Poverty Action Group.
Thank you. And the Child Poverty Action Group in Scotland, does that have any abbreviation or acronym?
It can be called CPAG. Some people outside the organisation also shorten it to CPAG.
Thank you. You've provided a written statement to the inquiry, is that correct?
Yes.
Thank you. My lord, the written statement, or Miss McKechnie's written statement, is reference SCI WT 01221. Ms McKechnie, we do have a limited amount of time today. I'm going to ask you some questions regarding matters that arise from your written statement. Your written statement will, of course, be taken into account by the inquiry in full, and if we don't have time to touch upon absolutely everything, there's no difficulty with that, and indeed in respect of any other documents that have been provided by CPAG in Scotland to the inquiry, His Lordship will have the benefit of those also. First of all, Ms McKechnie, I'd like to ask you some questions about the organisation itself. Could you explain to His Lordship who or what CPAG and indeed CPAG in Scotland are, in particular the objectives of the organisation?
So CPAG in Scotland are part of a larger organisation which is CPAG UK. We are an organisation that's been set up with the objective of reducing or eradicating child poverty. We do that through two separate routes, by providing welfare rights advice to help maximise families' incomes, but also through policy work in order to try and encourage decision makers to take the necessary policy decisions to reduce child poverty.
Thank you. And where is CPAG in Scotland based?
We're based in Glasgow. Our office is based in Glasgow, but we cover all of Scotland.
Thank you. And you mentioned there that there are two teams. I think you said there's the welfare rights team in CPAG in Scotland and a policy team. Is that correct?
We have policy staff in Scotland as well, yes, as well as the welfare rights team.
Thank you. And where does your role sit as between the teams?
I sit with policy staff, but my role is largely translating what are the findings from our welfare rights work into policy recommendations.
Thank you. You've indicated that you're the project manager for the early warning system. If I could ask you some questions just by way of introduction to that early warning system. Could you explain to His Lordship what is the early warning system?
Yes, of course. The early warning system was set up to monitor information that we were gathering through our second tier welfare rights advice line to identify any issues that might be arising with the benefit system, be that how the benefit system's operating or how families are interacting with the benefit system. So information that comes to the early warning system has been flagged by welfare rights advisors to say, we think this is an interesting case, you should have a wee look at it. And because I get to see all of the interesting cases, I can start to then identify the patterns, the trends, any emerging evidence. I also have frontline workers contact me directly to let me know that they have come across something that might be of interest. A lot of welfare rights workers work in organisations that don't have their own policy function, so they feel it's important to pass that information on so that it can be translated into policy recommendations.
Thank you. And so just so we can fit it in terms of the organisation, you're taking information primarily, you said, in addition with external information, but you're taking information from the welfare rights team in effect.
Yes.
And then passing it through to the policy team. Is that where it goes?
Yes, I mean, in some instances, that's me, that I will then turn some of that information into a policy recommendation or communicate the findings to one of the agencies delivering the benefits, be that Department of Work and Pensions, and more recently Social Security Scotland. But we'll also discuss those findings with officials at Scottish Government.
Thank you. You're obviously based in Glasgow, working for CPG in Scotland. How does your role interact with the UK organisation?
We will pass on findings from the early warning system in Scotland through to our colleagues at the UK, in the UK office as well in London. And during COVID times, we were working quite closely on what we were seeing coming through the early warning system in Scotland and at UK level, to be able to produce joint briefings from the UK office as well as from Scotland. The information that comes out of Scotland largely focuses on what are we seeing in Scotland and the interaction with Scottish benefits as well, and the information coming from CPAG UK largely focuses on the reserved benefits.
Thank you. If I could ask you now some questions just regarding how the early warning system actually operates. Mm-hmm. You've mentioned that you gather information, I think you used the term second tier advice line. Could you explain exactly what that is?
Yes, a second tier advice line means that we can support other organisations, but we don't work with members of the public directly. We quite simply don't have a big enough team in order to be able to do that. But it means that if somebody contacts, for example, a Citizens Advice Bureau anywhere in Scotland, the person within the Citizens Advice Bureau may not have their own welfare rights expertise, but they have access to our advice line where they can get that support.
Thank you. And you said that you deal with organisations and the like. Was there any change to that approach during the pandemic?
No, we still continue to work with organisations. We did find that sometimes people would contact our advice line because they were able to find that information online, that members of the public would contact us directly, but we would redirect them to other advice organisations where we could. So even though individuals were contacting you, would still divert them back away, so they would come back into. It would come back in, yes. Unfortunately, we simply do not have the resources that would allow us to support members of the public. That's a much more time. It involves a lot more time, and that we would not be able to deliver the service that we're expected to deliver if we were to do that. Thank you. I think you alluded to the answer to this question a little bit before, but perhaps I could ask you to expand upon it. How do you use the information that's coming in via the early warning system? So the first thing is to have a look at the cases to find out what it is, what's the information, why is this being passed over to me, and then really start to collate them all. In the olden, and at that point in time, it would have been using spreadsheets, and then noting where there were similar trends appearing within cases, so that we could identify if this was a recurring issue. Sometimes if we can have a look and see if it's particular to an area or if it's particular to a benefit, but it really is a case of just bringing all of that information together, and then identifying where those trends are. And then what do you do with that information once it's been gathered? So, depending on the circumstances at that point in time, I was sharing some of the case studies that were coming through with Scottish Government officials, DWP officials, just to highlight some of the issues that we're seeing. And then I produced some briefings, some reports that summarised and published those on the website of what the case evidence was that we were seeing at the time.
Thank you. You've mentioned there that you were feeding that back into specific government departments and the like. Did you find any change in terms of the availability of those departments, in terms of your feedback during the pandemic?
At the beginning of the pandemic, we were actually able to meet quite regularly, remotely, and most of the time we had quite good availability. There were sometimes we had difficulty getting response to technical questions, but I think that's probably the kind of that was where we had the issues, if it was a response to a technical question rather than availability. I think some things fell away that we would have had during the pandemic, like regular larger meetings. It was quite difficult, particularly in the beginning, to have those kind of some of those meetings remotely. We're all used to it now, but some of the times that was quite difficult. And I think staff sometimes in other organisations, such as Scottish Government, were focused on other areas sometimes. But I think certainly in those early days, I do remember having sort of fairly regular catch-ups.
And were those via existing lines of communication that you had pre-pandemic?
Yes.
Okay. I'd like to ask you now, Ms McKechnie, about some of the particular examples of the type of areas that you were dealing with during the pandemic. The first one I would like to touch upon is the question of childcare, if I may. Are you able to tell His Lordship what welfare implications or what was happening in respect of childcare during the pandemic?
So initially a lot of schools were closed and a lot of childcare providers closed, and that meant that people did not have the childcare that they would normally have relied on, and that meant that some people were unable to work. So the examples that we have was of, just to give you a couple of examples, somebody who had been furloughed but then was brought off furlough and had no childcare, so was unable to return to work and had to take unpaid leave. Their child would normally have gone to would normally have been at school. It would have been fine.
Could I ask you just to pause there a second, Ms McKechnie? So we're looking obviously at the welfare implications of that. So we have a situation where there's no childcare. Someone actually can go back to work from an employment perspective, but they're unable to because they've no childcare.
Yep.
And what are the financial implications of that?
In that instance, the parent had to take unpaid leave. So the financial implications are that they didn't have an income while they were only having to take that unpaid leave. We had another similar example of a key worker where the local childcare provision was full, the kind of emergency childcare provision that had been provided for key workers. She had to take 2 weeks sick and then had to take unpaid leave after that. And we had quite a few examples of parents finding themselves that they were either key workers and expected to return to work, or at the points when different things started to open up at different times, might be expected to return to work, but the childcare hadn't returned, or that the childcare that they might have been using, so for example, grandparents would have been shielding, that people didn't have access to the usual kind of childcare arrangements that they would have done, and that if they weren't able to work, that in some cases employers said you'll have to take unpaid leave. One parent was told that she might have to think about whether she could continue to work at all.
Right. just to reiterate there, Ms. McKechnie, so you've mentioned, I think, three potential reasons why childcare wasn't available. Firstly, that nurseries and things were closed, that they weren't open at all. Secondly, when they did reopen, they were full. And thirdly, that where they might otherwise, people where might otherwise have received assistance from friends and families or the like, that was not available. In respect to the third of those, could you indicate why that might be the case, why they might not be able to get access to friends and family support?
Well, certainly the example that I looked at yesterday was grandparents who would have been vulnerable themselves. And one other example, the friends and family all worked for the NHS, and so weren't available.
Thank you.
Just can I come back to the point about the local provision being full? Just to be clear that was the emergency provision that was full, that it wasn't the kind of normal provision that was full.
Thank you. When you're saying the emergency provision, do you mean in respect of key workers or?
Yes, yep.
Thank
So
you.
yeah, that parent had been a key worker and unable to secure provision.
Right, so even in circumstances where someone is a key worker, even there they couldn't access that provision?
Yes.
And presumably, therefore, potentially have the consequence of not being able to undertake that key worker role.
They weren't able to take the key worker role and had to take 2 weeks unpaid leave.
You've mentioned there the potential financial consequences in respect of unpaid leave and the like. Were there any other financial burdens that were arising in respect of childcare around that time?
We had a couple of examples of childminders who had asked parents to pay 4 weeks in lieu of notice for removing their child from the service, or to pay a small fee as a retainer in order to keep their childcare place. That was particularly difficult because Universal Credit will only reimburse parents for childcare services that have been provided, which meant if the parents had had to pay those costs, they would not have been able to get those costs reimbursed by Universal Credit.
So in circumstances where people might have been paying very little for childcare in ordinary circumstances, they were suddenly having to pay more effectively, more for less.
No, it was simply that I think people, because the childcare wasn't being provided, people weren't able to use their childminder. Universal Credit then wouldn't repay any costs because there had been no childcare provided. But on these occasions, the couple of childminders had asked for a payment. So it wasn't that the payment was more than the parents would have been paying in the first place, but it was that there was no service being provided that could be recouped through Universal Credit, and therefore the parents would have had to pay that themselves out their own pocket.
Thank you. And did those circumstances continue during the pandemic?
No, I believe that stopped. I thought that I had seen some guidance come from somewhere that when support is provided to child care providers, that would not be necessary in order to charge those costs, but I actually can't find that, so I may have imagined it.
Well, the inquiry will look for that, Ms. McKechnie. We'll see if we can find that. Thank you. You've mentioned there a number of issues. A number of issues regarding childcare. I presume these are the kinds of issues that come into the early warning system. Is that correct?
Yes.
Did you feed those issues back to government?
Yes, they would have been included in emails that we sent to Scottish Government officials.
Thank you. And do you know, you may not, Ms. McKechnie, but do you know whether you received any response to those feedbacks?
Usually just acknowledgement that the information had been noted, and not that specific action had been taken at that point in time.
Thank you. Again, you may not be able to comment directly on this, but do you feel that the government took on board the information that was being fed back to them?
I think so, yes. I mean, I think they were probably at that point in time being fed so much information. But yes, I think certainly these issues were acknowledged.
Thank you. We've spoken about childcare predominantly affecting young children. We're talking about nurseries and the like, and childcare that prevents parents working. Could I now ask you regarding the position of children and young people, but I'm thinking of older children at this point. Were there any issues affecting older children's positions?
The issue that we found was around 16 and 17-year-olds. You can't claim universal credit until you turn 18. Some 16 and 17-year-olds will be able to claim benefits such as universal credit if they are estranged from their family. But if they're not estranged from their family, they would normally be included in the household's benefit unit. But once you reach 16, you're only still considered a child for the purposes of your parents' benefits if you continue in education. And what we saw was that some people had left school and were waiting for an apprenticeship or to move on to a new course of education, a new study that had been delayed or cancelled, and that meant that there was no provision in terms of providing additional financial support for those children. They were no longer in school, so they were no longer considered children, but they were also not considered adults, and so that meant that the parents had financial responsibility for them without receiving any additional income for them.
Thank you. So in circumstances where the system would have allowed for them, while they remained in education, effectively they would form, as you say, part of the household unit, the expectation presumably being that they would be able to earn.
Either that they would be earning or that they would move into the next stage of education, which would allow them to stay within the family benefit unit.
Thank you. And did that change at all during the pandemic, you know of?
No.
I'd like to talk to you now about people accessing the benefits system. In particular, first of all, I'm going to ask you some questions about how people access support and whether there were any issues identified in that regard. Were there any issues identified in respect of people with disabilities?
Yes. There are a lot of people who need support in order to be able to make a new claim for benefit, to manage their ongoing benefits, to manage assessments, or to support with appeals. That might be because of disability, mental health, literacy, accessing IT, accessing the internet, or the ability to use the internet. And we know that while services were shut down, a lot of people would have been accustomed to having face-to-face support, and quite often having somebody sitting beside them to do some of these things, and that just simply wasn't possible. And that shift might have been easier for people for some people in relation to online support. But for a lot of people with disabilities, that actually was a lot harder. And so we heard of issues with somebody who required an assessment for disability benefits, who was hearing impaired but was offered a telephone assessment as the option, and obviously that wasn't suitable, and it meant that they had to wait a long period of time before their disability could be assessed. Now that was important because once you go through the assessment, if you are assessed as having a disability, you will receive an extra amount of money in your benefits that recognises your level of disability. It recognises that you need extra support. So people were having to wait long periods of time without that. There were people who were, somebody who was hearing impaired and sight impaired, who needed to make a new claim for personal independence payment, the disability benefit at that point in time, and who didn't have access to support, and so had to wait a long time before they could actually make that claim. There were people who were shielding, who couldn't go out to access the internet. A lot of benefit claims are made over the internet, so that they couldn't do that. So I think that was where people really acutely felt it. Some of the issues around the pandemic and things with services being shut down and people not being able to come in to people's homes or not being able to go and access the internet in other places. That I think particularly for people with disabilities who were more vulnerable and had to be protected from COVID more, that when other people started to return a wee bit more to normal and as other things opened up, I think that was prolonged. It was prolonged for people with disabilities. That lasted a lot longer.
Thank you. Do you feel enough consideration was given to these factors when systems were being designed?
I think at the point in time that the systems were designed, they probably couldn't have foreseen the impacts that there were going to be, and I think looking ahead, that some of the issues will have been overcome because of the way that we responded to the pandemic, and there were different ways of working. But I do think it would be good to sit down and just check if something like this was to happen again, is the benefit system now, would it cope, and would it cope for everybody who needs it, not just the people who are able to access the internet without support, make claims without support. Will the necessary support be in place?
Thank you. I'd like to talk to you now about access or the grant of funding, I suppose, in terms of the ability of people to get funding through welfare or otherwise. Did you identify any gaps, any particular groups that struggled with that?
Mm-hmm. Yes. Primarily people who have come from abroad, who don't have, who wouldn't necessarily have access to benefits. And at that point in time, and this has changed due to Brexit since then, but at the point in time, we would have European nationals, EU nationals, who may not have been able to establish a right to claim benefits unless they were working or unless they had a good solid working history. And for a lot of people who either had no work or no childcare, they were unable to work and therefore unable to establish a right that would entitle them to claim benefits. So that was for the EU nationals. Then we had people from outside Europe who would have a no recourse to public funds condition attached to their visa, and that means that they would not be entitled to claim benefits. And some of the examples we saw from that were people who had been working but their work stopped, somebody who was self-employed but had to shield, so had to stop working, and then students whose course was suspended. So all of these people with no recourse to public funds really could not access any benefits. At that point in time, a lot of the people that we heard of were relying on food banks or help from the Scottish Welfare Fund. But it did mean that there was a group of people who were without access to benefits and essentially relied on friends and families and charitable support. Another group who faced a gap in support were students. Students who don't have children, don't have any disabilities, can't claim universal credit themselves. So a lot of students will get some student support, but will usually supplement their student support by working, and then that work wasn't available. And so they suddenly found themselves on much lower incomes than they had previously. The Scottish Government did introduce discretionary funds for students, or increased the discretionary funds available for students, but that wasn't until a wee bit further down the line. And so there was a period of time where there were students who were struggling financially, having been unable to work.
Thank you. You've mentioned there discretionary funding for students. Was there other discretionary funding available?
There was the Scottish Welfare Fund. The Scottish Welfare Fund is a discretionary fund that is delivered by local authorities. It's funded by the Scottish Government, and people with low incomes can apply either for a community care grant or a crisis grant. A crisis grant kind of does what it says in the tin. It's you're in crisis, you've no money, you need something. Community care grants are usually to help with people who have moved from homelessness to settle into a home if they've got perhaps no furniture, or if there are exceptional needs within a family that mean that you might need a new washing machine, your washing machine's broken and you need to be able to repair it, and you could apply to the Scottish Welfare Fund. The Scottish Government invested an additional £45 million in the Scottish Welfare Fund at the beginning of COVID. But a report produced by ourselves jointly with Aberlour and One Parent Family Scotland suggests that the delivery did not meet Scottish Government's ambitions. Those other organisations, Aberlour and One Parent Family Scotland, saw an increase in the number of applicants to their hardship funds, to their own charitable hardship funds at that time, but often saw that people had already tried to claim Scottish welfare, apply to the Scottish Welfare Fund beforehand, but been unsuccessful. And some of the issues with the Scottish Welfare Fund at that point in time were that in some areas, the community care grant claims had been suspended entirely in order for staff to focus it purely on crisis grants, which caused difficulty for anybody who was needing a community care grant. There were difficulties with the application process. It was online only in some local authorities, and for people who weren't able to apply online, that meant that they couldn't access the fund. And in terms of the information available, there are 32 different local authorities and all had different information on their websites, some of which was out of date, some of which just didn't mention COVID at all. And some of them include an eligibility checker, which knocks people out when it actually shouldn't have done, that people should have been eligible to apply for the Scottish Welfare Fund. So whilst the additional fund was provided, there was still some difficulty with the delivery of the fund at the time.
You said there that the distribution didn't meet the government's ambition. Just to be clear, what do you mean by that?
Really just that the Scottish Government had provided these additional funds for the Scottish Welfare Fund, hoping that it would meet the needs of people who were applying to the Scottish Welfare Fund, recognising that there would be more people trying to claim crisis grants and potentially community care grants. But in terms of the delivery, local authorities were struggling to match the ambition that the Scottish Government had had.
In terms of what the effect of that was that monies were not paid out?
It meant that people were having difficulty accessing the fund, and so sometimes people would have gone to other sources of charitable support, such as Aberlour and One Parent Family Scotland. And some local authorities would have spent less than we might have expected them to. Other local authorities would have managed to spend it. I don't think there was any question of the money not being spent in the end, but at the point in time when people needed it, sometimes they weren't able to access it.
Thank you. We've mentioned Scottish welfare, effectively devolved welfare to this point, and as you know, His Lordship's terms of reference are in respect of the Scottish response, the response in Scotland effectively by the Scottish Government. In your statement, you've made mention of a number of UK benefits, and whilst acknowledging that those are reserved matters, you'd highlighted that can nonetheless have an impact in respect of matters in Scotland and support in Scotland. I wonder if you could expand upon that for His Lordship.
Yes, certainly. There are the benefit system is intertwined essentially, so that you can claim benefits from the UK, and depending on your entitlement to that benefit, then that can impact on whether your entitlement to benefits that are delivered by, at that point, Scottish Government. So in that point in time, it would have been things like free school meals and school clothing grants. The local authorities deliver things like housing benefit. Now, personal independence payment that was at the time delivered by DWP, that has been devolved and is now delivered by Social Security Scotland. So it's important that any lessons that needed to be learned from the delivery of personal independence payment are learned for adult disability payment now.
Thank you. So, again, just to be clear, we're in a situation where there are effectively entitlements that flow from some of the reserved.
Yeah.
Once you get that, I was going to say badge, but,
Yes,
but effectively
yeah.
qualification in respect of those flow through into further benefits that are available in Scotland.
Yes.
And indeed, as you say, there's now been a transfer between the DWP and the
Yes.
SSS in terms of delivery. Thank you.
Yep.
You spoke before in your evidence regarding assessments. I think in particular you were talking about a deaf and blind individual and delays in terms of that particular individual's assessment. Was that a position that was a one-off, or was that something that you recognise as a general theme?
That was a general theme. There were assessments initially were cancelled, and then they were moved to telephone assessments. And as we said, telephone assessments weren't necessarily appropriate for all people. And there were delays in a lot of the assessments going ahead. There were people who needed to notify that there had been a change in circumstances, for example, a deterioration of their condition, or with that they had now been diagnosed with a terminal illness. Those things would entitle them to additional amounts in their benefits. And things like those were taking an awful long time to process. And that meant that people were having to wait for an additional amount in their benefits that they weren't able to get timely.
Thank you. You mentioned that there was a period when the assessment stopped.
Yes.
What was the effect of that?
That simply meant that people had applied for the benefit and they would not get the benefit assessed, and that meant that they would not get any additional amounts of money that they might be entitled to. They just wouldn't get the benefit at all.
When assessments restarted, was there any consequence in terms of the amount of time that it would take because they had stopped for a period?
Yes, there were huge backlogs, so it took much longer for these things to be processed than they would have been otherwise.
Thank you. I'd like to ask you now some questions about the effectiveness of the support and really about the types of support that were being provided. You mentioned in your statement that some of the support was provided via vouchers, in particular in respect of school meals. Mm-hmm. Could you elaborate on that for us, please?
So, children, families and low incomes are quite often entitled to free school meals. This is a really valuable and vital bit of support for low-income families, and it essentially means that children get a lunch every day. And with the closure of schools, it was really important that that was replicated somehow. And local authorities were swift with their response, but the initial response by many local authorities was provided in the form of vouchers. And that was really difficult for some parents to use, either because some parents they were quite often for specific shops, So there was the accessibility of those shops. In one instance, we had a parent who had saved all her vouchers because she'd been shielding, and then when she went to use them when she was no longer shielding, they weren't active anymore. So in effect, she'd had to use her savings to pay for food at that point in time, and was hoping to use the vouchers to balance that out because she hadn't been able to use the vouchers at the time. By the summer, most local authorities, so by June of 2020, most local authority moved to cash payments. This was much better because it gave the families choice, it gave them dignity, it meant they could shop online if they needed to, it meant that they could put the money towards the types of food that their family ate. So it was really important in terms of just families being able to manage their own budgets, that have that dignity and have that choice.
You've mentioned the word dignity twice there.
Yeah.
Ms McKechnie, could you explain what you mean by that?
I think for low-income families, it can be quite difficult if they have to use something like a voucher that labels them as being you're on a low-income family, particularly if the shop that they then have to use that in is somewhere where they know people. That something that might have been very private to them becomes public, and that can mean that people won't access that support because they fear the stigma associated of accessing the benefits or being labelled as a low-income family.
Thank you. You mentioned that a lot of local authorities moved ultimately to a cash-based, a money-based approach. Is that something that CPAG, I was going to say in Scotland, but CPAG probably, is that something that it would support in terms of an approach?
Yes, we called for that at the time and spoke about how important it was that provision was provided and as a cash-first approach rather than in kind or in vouchers.
Thank you. I'd like to ask you now about, I suppose, future planning, emergency planning going forward. You've alluded to the fact that benefits have been transferred from the reserved position from Westminster Government to the Scottish Government. Are there any consequences of that in terms of planning, do you think?
I think really check that any of the lessons that we've learned from the pandemic, that they have been incorporated into the planning for the delivery of the Scottish benefits, because they weren't being delivered at the time but in Scotland. They were delivered by DWP, and looking at the system, a lot of the way that it's been set up, because it was set up sort of during and post-pandemic, a lot of it is responsive to being more online or being, but it would be worthwhile just double checking that every step of the process, that there's nothing that would mean that somebody slipped through the gaps.
Thank you. One of the major things which His Lordship will be looking at when the inquiry reports are particular lessons that need to be learned from the pandemic. You've just mentioned one there. Are there any other lessons that you would like to highlight to His Lordship as being particularly important for him to consider?
I think we've talked about the issues with the benefits, recognising that if there's no childcare, that lots of parents can't work, and that has implications. And I think one of the things that we found difficult as an organisation in terms of providing advice is sometimes that when new support was brought in, for example, the self-isolation support grant, it wasn't clear how that was going to interact with other benefits, and that made it very difficult for people to know whether they should claim that support if it would impact on the benefits that they were already getting. So it would be really helpful if if there is future planning, if things are just going to be in place, that somebody can press a button and say, right, that's it, we need all of this, that those things have been thought through.
Thank you. Ms McKechnie, that's all the specific questions I wanted to ask you this morning. I know, and as we've discussed, your statement covers a number of other matters, which, as we discussed, we're hearing from lots of other witnesses, and I'll avoid duplication, if I may, in terms of this morning's hearing. I'm going to give you an opportunity in a moment. If you think there's anything that you particularly want to highlight that you think is key from your statement or otherwise, that you'd like His Lordship to know. I will just remind you that your statement and all the documentation that you provided to the inquiry will be taken into account, and His Lordship will have the opportunity to consider that. But if there is anything that you would particularly like to highlight to him now, this is your opportunity.
No, I think we have covered everything that was keen to highlight. Thank you. Thank you,
Thank you
Lordship.
very much. My Lord, that's all the questions I have, unless your Lordship has anything else you would like to ask.
No, thank you, Mr. Turner. All that remains for me to do is, Ms McKechnie, thank you for coming and giving evidence today, and thank you for your evidence. I'm grateful. We'll take a break now for lunch, and we come back at 12:45. Thank you.